I was always in pain. I've spent a small fortune at the dentist over the last 8 to 10 years. I would wake up in the middle of the night in pain. I'd have to get out of bed and go downstairs into the dark and just calm down so that I could go back to sleep. I would say that I haven't slept a full night's sleep in probably 8 to 9 years.
So Tim had been a patient of ours for a while. We had done one implant in one of his anterior teeth. At the time of his procedure years ago, I had suggested to him that due to the position of his teeth and the injuries that he had sustained when he was younger, as well as the numerous amount of root canals that he had experienced a lot of pain. Tim flies 2 million miles a year. He's vice president of a major company, and he's living with a constant chronic pain. He's on antibiotics. He sees ENTs. He sees neurologists. He was in so much pain that he was at his wit's end.
And I was just sick of it. And so I had always gone to my regular dentist. They would always tell me that there was nothing wrong with my teeth, that they fixed it piecemeal, as symptoms occurred, but it was just always problematic to me.
And the pain that he was describing was throughout his head: sinuses, mouth, eyes, pressure. I had recommended Tim, when he came to see me recently, that instead of addressing the small area, we should look at Tim as a whole. And we should address the patient as a whole, just like we do with everybody else. So my recommendation, after Tim had been through orthodontic treatment, multiple crowns, multiple restorations, that we start over.
He told me a conservative, a moderate, and an aggressive approach to fix it. I chose the aggressive. I just put all my trust in the man. And 30 days later, I was getting new teeth.
We sat down with Tim and we went over the procedure. We were going to remove the existing upper teeth, and that same day place 6 implants in the upper jaw. And it turns out that our reconstructive efforts have cleared up his pain. He doesn't have chronic pain anymore. He doesn't have sinusitis anymore. He doesn't need sinus surgery. And to boot, he has a new smile, a new dentition, and he's confident and he's happy. And he said to me, for the first time in years, he doesn't have pain. So he's able to sleep, he's able to function, his activities of daily living aren't compromised, and most importantly, he's happy.
I'm not an emotional guy. When it was all over, I remember waking up from the surgery. I don't remember much about the surgery, obviously, because I was knocked out with anesthesia. But I woke up and my first comment was, "Oh my God, the pain is gone." I think Dr. Kerr was a little bit surprised because the surgery happened on a Friday, and on Monday I went in because I was a little bit swollen, and I just was, I guess, being neurotic and wanted to make sure everything was okay. And he said, "How's the pain?" I was like, "It's fine." I think he was surprised I didn't take the painkillers because the pain from the surgery was nothing compared to what I had prior to it. And then I think he was even more surprised that I got a little emotional when I said thank you and hugged him. Dr. Kerr's not exactly a tall guy. I'm 6'3", so I just kind of hugged him. It was life-changing.